The Association of Respiratory Nurses plays a vital role in delivering specialist care to the population it serves. ARNS works tirelessly to influence the direction of respiratory nursing by leading, empowering and influencing modern pathways of care, such as virtual wards for patients living with respiratory disease.
Hi John, how are you feeling?
Not too bad, thank you.
Okie dokie, so I'm going to put you back on the virtual ward.
Right.
Manage this chest infection.
John Green had been discharged from the virtual ward, but recent cold temperatures triggered his chronic lung condition, so he's being readmitted. At 83 years old, he's a big fan of the technology.
I'm old school, and I didn't think this thing would work, to be quite honest. I didn't think there was anything like this in the world. But there is, and it's amazing, and I say to everybody, please, if they ask you to do this, please do it, because it will take all the stress out of your life.
They know that somebody's monitoring them 12 hours a day, 7 days a week, and we have a plan of care that we agree with them for what they need to do sort of after hours if they feel unwell or their condition deteriorates.
Specialist nurses keep a close eye back at the hospital hub, where virtual ward tech experts and the community rapid response team look for anything outside of individually agreed parameters.
This digital board represents 26 virtual ward beds. That's 26 people who don't have to be in hospital. With the inevitable winter pressures on the NHS, the ambition is to expand this to 40 virtual ward beds.
The one we use on the Isle of Wight, it links each patient's equipment, Bluetooths their readings to a tablet in their home, and then from the tablet the readings come through to an online platform. All the patients are listed and we can see what their readings are.
With 1 in 3 deaths in England attributed to respiratory disease, it's a multidisciplinary approach here, with patients given access to a range of medical professionals according to need.
Respiratory illness is a huge burden to our healthcare system, especially over those winter months that we talk about all the time. Respiratory admissions are one of the highest that we see in hospitals and emergency care. But for us as respiratory nursing groups, what we can do is provide that care outside of the traditional hospital setting, somewhere else on virtual wards, where we can give good specialist care to patients at the same level of excellence that they get in hospital, but in their own home.
Your respiration rate is 14 breaths per minute.
ARNS is championing best practice on using technology to care for patients at home, aiding faster recovery and reducing hospital-acquired infections. ARNS is also an important voice for respiratory nurses, as the only respiratory organisation created by nurses for nurses.
We are key stakeholders on many national papers, projects, work groups, work streams, through nursing, right the way across medicine, allied healthcare professionals. So, we will be one of the first groups to be contacted, to review such documentation, to add our specialist opinions. So, we are really representing respiratory nurse opinion at the national table.
Its work also extends beyond the hospital into the wider community via primary care nurses.
Our main role would be to support people who have been diagnosed with a long-term condition such as asthma or chronic obstructive pulmonary disease, or one of the myriad long-term conditions, to understand how a combination of lifestyle and medication can really allow them to continue with living their best life. So it's very much about keeping people well as much as we possibly can.
For 25 years, ARNS has known that respiratory nursing is a really special place to work, and it's something that we're really proud of, being able to support other nurses working with patients with respiratory illness to be able to manage that care and really just have that nursing voice on a national platform. The vision for ARNS is to make sure that we continue to support the respiratory nursing group by leading, empowering and inspiring the future generation of respiratory nurses. That's what's important to us.